you on our patient from yesterday because you guys were all very concerned. We're doing such an extensive procedure. You guys want to make sure that he's doing well. He is in our aftercare, and I want to show you guys because this result is going to be phenomenal. Remember, you saw all these irregularities and indentations. This was actually a lot of scar tissue, was not necessarily just fat. And if you take a look at his chest, it was very much sagging. We call this the unhappy or frown chest because there's like a sad face. So now if you take a look, you could see he is much flatter. He has more of that athletic look that he was going for. And take a look at the chest. Dr. Rojas, describe what you just did on the showing on the chest.
So as you can see, the areolas were droopy and also elongated. So now we brought them up. We call it the nipple lift, and also rounder. Right now you cannot see it because of the steri strips, but we made them rounder. And the definition we have accomplished, framing the chest with the lipo and the J plasma, and then the fat grafting, it's amazing. It's
huge
really,
result.
really
And
impressive.
the aftercare is really what's going to help us with the fat grafting, especially the hyperbaric oxygen therapy, and massages, and IV therapies. All of this necessary to be able to go through an aggressive procedure and not have as much bruising. You could see his six-pack already starting to show he had that muscle underneath, but it wasn't visible, and it wasn't visible because he had scar tissue and loose skin. Plasma helped tighten the skin. The other thing he did was enhance the arm. Take a look here, right here, you guys. You could see the arm much more flat, not as round. Now take a look. We have that roundness of the deltoid. The bicep is swollen. We did graft it, and his tricep will be more defined. And on the back side, he will have much flatter, tighter look. Same thing on this side. He's still very swollen, but you could see the roundedness there, and it's going to be pretty amazing. So the goal now to keep this, and I'll show you guys a 45 degree. You guys could see, look at that excessive tissue, fat, and again, look at the chest, completely flat. Now rotate in 45 degrees, show them a sort of 45. You now can see the roundedness in that chest. It's not flat anymore, it's filled with the fat. You can see the border of the chest being more defined, and you can see all of this completely gone, flat and tight. And so that's gonna be an amazing result. Now, how do we kickstart and improve this result even more? Peptide and hormonal therapy, really important. It's one of the things we've been doing for 3 years before peptides became popular, and giving this to patients before surgery and afterwards. So someone like him, it's going to take it to the next level at the gym, at least for 6 months. Doing that will really help tighten the skin, prevent scar tissue formation, and get more muscular growth, and then also help him heal more quickly. There's a peptide, BPC 157, that helps athletes heal and decrease inflammation, would help in this case significantly. And then he's got to get back to the gym. So in about 3 to 4 weeks, he'll be back to the gym. And some of this fat may go down, but the goal is with the aftercare and all the working out, it will survive. In this case before, one of the things he could have done was an implant, and we could have used the fat elsewhere, but we're going to use fat first and see how much survives and then go from there. What are they saying? Any questions?
We answered all.
Want to say anything, Dr. Rojas, about gladiator procedure?
No, I want to reinforce that this is, a commitment for healthy lifestyle. And right now, we set the stage for success. He looks unbelievable. I think I'm jealous.
I agree.
It's amazing.
This is going to be so good, and I just can't. When you look at this before and you look at the after now, it's a completely different body. So that's the goal, an ultimate body transformation. That's why we call it a gladiator procedure. Have a good day, you guys. Perfect. All right.